Frustrating thing is being a medical professional in a corporate environment where business people are making decisions that are not in line with the best healthcare practices because their goal is making more money. You're talking about an important unwritten rule in American businesses, including healthcare. The irony is unwritten rules cost a lot of money. In other countries' healthcare are making efforts to reduce this. So I refer to this as the unwritten rule of being assertive, but not too aggressive. And what other countries have figured out is that when healthcare workers can't speak up, patients unalive. People get hurt, and healthcare workers get bullied. So a lot of other countries have been studying and implementing assertiveness training and evaluating how it works, not just with what do those employees remember or did they like the training, but did it help improve the healthcare setting. For example, I found a systematic review, meaning a review of a lot of studies on that topic by Australian researchers, and they looked at programs across multiple countries, and they taught healthcare workers specific communication techniques on how to speak up and voice concerns to authority figures, how to challenge someone's decisions respectfully, and some of them even role play difficult scenarios between doctors and administrators. Some of the programs use multi-method approaches like face-to-face training. Some even borrowed techniques from aviation training, because as they say, mistakes in aviation are written in blood. And it worked. The training was more effective for nurses, medical students, and most healthcare workers. The only one it wasn't effective for was anesthesiologists, but those are usually already people who are considered authorities and experts, and so they probably already know how to assert themselves. They don't have the same backlash and occupational status clashes. Workers did become more confident in speaking up for patient safety. And Cytoperk, one study on 241 nurses, found that when people could be more assertive, they also experienced less bullying. And bullying is notorious in healthcare, especially for nurses. One thing I noticed, because I'm reviewing assertiveness literature for the chapter in my upcoming book on the unwritten rules of work, is that a lot of these studies were not conducted in America. And in my research, I have found that American workplaces often enforce the unwritten rule of compliance, which is that you are expected to not disagree with authority. Even if they ask you, you're just supposed to kind of go with it. And people from working class backgrounds and neurodivergence have a major problem with this. And there are money related outcomes that this impacts in addition to patient safety. When your patients aren't safe, you get sued. When your healthcare workers can communicate effectively and not bully each other, you have lower turnover. Gallup estimates that when you have to replace someone, you spend between 40% and 200% of their salary replacing them. But a lot of workplaces don't measure that. You know how high turnover is in nursing? It's up there. You also have higher job satisfaction. People do their jobs better, which in healthcare is important. That gives you more productivity, more bang for your buck, and reducing medical errors, which, oh yeah, fewer lawsuits, and one day you might be a patient, darling. So I'm curious for especially the healthcare professionals out there, what would addressing this unwritten rule, really two of them, assertiveness and compliance, how would that look in American healthcare for you?